Kia ora tātou. Lovely to see everyone. I wish I could see everyone. This webinar format's a bit like doing radio. You have no idea who's out there, but I have the real pleasure of introducing two incredible speakers. I was lucky enough to meet with them recently and was just glued to the screen hearing from them about some of the incredibly innovative work that's happening in Canada. So to hand over to Dr. Amanda Slaunwhite and Dr. Palis, and they're dialing in from BC, where Dr. Amanda Slaunwhite is the Senior Scientist at the BC Centre for Disease Control and is an adjunct professor in the School of Population and Public Health at the University of British Columbia, with an expertise in overdose, substance use, addiction and mental health. And the work that they're doing is incredibly groundbreaking and also ties into this COVID-19 topic as well. Kia ora, welcome.
Thanks so much. I believe somebody's going to be sharing our screen for our presentation. Great. Thank you so much for having us here today. Next slide. We'd like to take a moment to acknowledge that the work that we do at the BC Centre for Disease Control and the University of British Columbia is located on the unceded ancestral and traditional homelands of the Musqueam, Squamish, and Tsleil-Waututh nations, and we are very grateful to work on these lands and to work with members of those nations as part of our work related to overdose and prescribed safer supply. Next slide, please. So BC has been struggling for quite some time with overdose. I think it's important to kind of step back and see what has happened over the past 5 years. So on average, since 2016, BC has had a rate of overdose that is attributed to illicit substances that is double the Canadian average. And this has been the case going back, like I said, to 2016. And we did see a slight decline as well as a national decline in overdose deaths that were occurring in 2019. However, since the COVID pandemic started in March 2020, we've seen this rapid escalation, acceleration of overdose, non-fatal and fatal overdose in BC. And so we are in a dual public health emergency here in the province. Next slide. So the illicit drug supply, the contamination of the illicit drug supply is the central contributor to overdose in BC. And we know this because of linked data that we have at the BC Centre for Disease Control that was facilitated through the public health emergencies. These are unintentional overdose events. We've been able to look at post-mortem toxicology, and what that tells us is that prescription opioids are not the drivers of overdose right now in British Columbia. It is really the illicit drug supply that has been very contaminated by fentanyl. And so you can see the figure here shows the percentage of fentanyl detected in illicit drug toxicity deaths with extreme fentanyl concentrations. And really since 2020, we've seen this increase in the proportion of deaths where extreme fentanyl is detected. And that coincides with the COVID pandemic, border closures, and now domestic manufacturing of fentanyl and other substances that perhaps are not as well filtered, and we are finding that there are contaminants, including precursors in the illicit supply now, that are leading to more overdose events. Next slide. So in the context of an overdose crisis in the province that has been fueled by the illicit drug supply and the contamination of the drug supply with fentanyl and other drugs, the province of BC introduced risk mitigation guidance in March 2020 that allowed for the prescribing of a selected number of pharmaceutical alternatives to the toxic drug supply, otherwise known as prescribed safer supply. So the way that this works is that physicians are now able to prescribe selected opioids, stimulants, and benzodiazepines to people who are using illicit forms of those substances. And the purpose of this is to support persons when they are self-isolating for COVID-19, but also to help reduce the likelihood of overdose. And over the past 6 months, the province of BC has introduced a new policy directive to have this continue on past the COVID-19 pandemic, really emphasizing that really a result of the influence of the toxic drug supply on overdose in BC, and that these two are very linked. And so when we do see the contamination of the illicit supply, we see an increase in overdose. And in the context of this, we need to take a public health approach that really helps to reduce reliance on the illicit drug supply by providing pharmaceutical alternatives. Next slide, please. Thank you. So in the context of this new policy directive and the prescribed safer supply initiatives, we launched a mixed methods evaluation of these policies that were introduced in March 2020 with a team of investigators from the University of Victoria, Simon Fraser, and UBC, and this was funded by CIHR and other agencies. And the purpose of the evaluation is to examine the impact of risk mitigation prescribing on persons who use substances, as well as the implementation and the perceptions of prescribers, and to see we're using mixed methods, and so we are using quantitative and qualitative data, including linked administrative health data. And so we are able to look at the long-term impacts in terms of overdose, drug-related hospitalizations, and mortality. Next slide. I will turn it to my colleague.
Hi, everyone, and thank you so much for having us. My name is Heather Palis. I'm a postdoctoral fellow here at the BC Centre for Disease Control, working alongside Dr. Amanda Slaunwhite. I have to apologize. It looks like, I'm not sure if it appears the same on your end, but the table looks a little bit messy. But essentially here, what we're going to be presenting is early surveillance data around prescribing of these medications. And the table that's there is meant just to outline the medications that were included in our risk mitigation guidance. So as Amanda mentioned, that included opioids, stimulants, benzodiazepines, and alcohol withdrawal management medications. As you'll see, the large majority of prescribing has been around opioid prescribing, and that includes hydromorphone tablets and MS-LON, which is morphine. One of the challenges that we've faced in doing our evaluation of this program is that all of these medications were already available in British Columbia and being prescribed for other purposes. So we have developed a case definition to be able to identify these medications from our drug dispensation database. I'm not seeing the slides on my end anymore. Oh, maybe they're coming back. So yeah, that drug dispensation database is PharmaNet. So we look for each of those medications using drug identification numbers. And then we also looked at applying different keywords to a directions for use variable, which is where prescribers write down the purpose of the medication and the intention of what it was prescribed for. Next slide, please. So what we identified, which was that from March 27th, 2020 to the end of October of this year, there are over 11,000 people in our province that have been prescribed these medications. We have basic demographics listed here, and really these represent quite closely a similar profile to people who are at risk of and who are dying of overdose in our province. So we see most of the prescribing in the age group of people aged between 30 and 39 and 40 and 49. We see about a third of the prescribing among females. And then we really have a concentration of prescribing in our more urban centers and urban health authorities. So within Vancouver and Victoria, which is our capital and another urban center. Next slide, please. So overall, I mentioned most of the prescribing has been around the opioids. We saw that of all of the people we identified, approximately 60% of them received opioid medications. Approximately 20 received stimulant medications. Approximately 25% received alcohol withdrawal management medications, and then about 13% received benzodiazepine medications. Next slide, please. So one thing that we'd like to highlight here is the data at the dispensation level rather than the person level. So what you can see is that across our period of analysis from March 2020 to the end of October of this year, there were approximately 440,000 unique medication dispensations. The large majority, almost 80% of those dispensations were for opioids. And what we really want to highlight is the daily dispensation here. So you can see that almost 95% of all of the dispensations of this medication or of medications under the risk mitigation guidance policy were dispensed daily. So what that means is that people are coming to a pharmacy every day to pick up their medication. Next slide, please. Another piece to highlight in an area that prescribers here in British Columbia have been really interested in is the prescribing of risk mitigation medications alongside opioid agonist treatment. And what we did see is that these safer supply interventions really are rolling out in the context of existing treatment programs. So of the close to 6,500 people that have received an opioid risk mitigation prescription, more than 70 of them were already on opioid agonist treatment at the time they began risk mitigation dispensations. We also saw that for people that weren't already on the medication, about 20% of them were started on it. So that left us with only about 8% of people overall who were prescribed these medications or these opioid medications outside of the context of being concurrently prescribed opioid agonist treatment. So that's kind of a very broad and general overview of our initial surveillance of this program in British Columbia. Kind of some key takeaways are really to highlight, we know that there are many health inequities that have really been exacerbated in the context of COVID-19, and prescribed safer supply interventions really provide us with an opportunity to reduce the harms of illicit substance use, including overdose. And our team is currently working with the broader group that Amanda introduced on sort of an evaluation of specific outcomes, including overdose and mortality, to really be able to show whether these interventions are effective at meeting those objectives. So thank you all so much for your time, and we're happy to take questions and have some discussion.
Got it, and thank you for that. Now I'm just going to hand over to Hayden to let us know if there are any questions or comments that are coming through from.
Yeah. Kia ora tuari. I've got the unenviable role of trying to determine the questions that we've got and pose them to our different speakers. Thanks all so much for your really interesting speeches. We've got a question here, which I think is for Heather and Amanda. Was a question about whether the overdoses are intentional. Not sure. I think that came from early.
No, these are unintentional overdoses. Yeah.
Great. That's how was the prescribed drug program advertised to users at risk of overdose?
So that's an interesting question. So it was introduced or was advertised to people who use substances through drug user organizations. I do think it was a little bit of an organic type of process. It was introduced very rapidly, and in the context of March 2020, I think we all remember when the pandemic was starting, and there wasn't a large implementation strategy. So there was some physician education in the months after it was released, but it really was an organic type of process with persons who use drugs really leading that in terms of advertising and knowledge to people who use substances who might be eligible. Yeah.
We've got a question here. Was there any political kickback?
So it was introduced by the government of BC in collaboration with the BC Centre on Substance Use, and the province of BC has been moving forward efforts to decouple this actually from COVID-19. And so I would say that we are the only province in Canada that has this, where we have a provincial policy that allows for prescribers to provide substances and pharmaceutical alternatives to the toxic drug supply. This doesn't exist anywhere else in Canada except for pilot programs in some provinces. And so I think our province has been really leading in terms of implementation and also developing these policies. But I think the context of this is we have an extreme overdose crisis here in the province. And so there's a lot to do.
Well, kia ora both of you. Thanks so much for your time and for joining us from so far away.